My name is Brian Sharman, and I'm the owner of First On Scene CPR, operating out of Palm Beach County, Florida. I'm a certified CPR instructor with over 15 years experience teaching life safety courses. I'm also a nationally certified firefighter and paramedic, and I hold the rank of operations captain at a high volume urban fire department in Southeast Florida. The LifeVac device is for both adults and children over the age of 1. Today, I will be instructing you on the crucial steps to take in case of a choking emergency. I will explain how to use the LifeVac device intended to resolve choking in a victim with a complete airway obstruction when the current choking protocol has been followed without success. LifeVac can be administered by a layperson or a medical professional of 18 years or older in various settings, including at home or nursing homes, restaurants, schools, and other outside environments. We recommend that you become familiar with LifeVac before potential use. Please review all instructions provided in the LifeVac kit. The LifeVac device uses 2 components, a suction unit and a mask, which will be described in more detail a little later. Instructions for use are provided in multiple locations, including the outside of the bag, inside the bag, and a shortened version is also provided on the suction unit. Before we get started, it is important to re-emphasize that LifeVac does not replace the need to call 911 or attempt the choking protocol prior to use of a LifeVac device. Recognize a complete airway obstruction. Someone who is suffering from a complete airway obstruction will not be able to speak, cough, or make any noise. They may be trying to communicate to you non-verbally by placing 2 hands around their neck, performing the universal choking sign. If you suspect that someone is suffering from a complete airway obstruction, first ask them, "Are you choking?" If they nod their head yes, ask them, "Can I help you?" If they are able to cough, encourage them to cough forcefully in an effort to clear the obstructed object from their airway. If the cough is unsuccessful at clearing the obstructed object from their airway, progress to step number 1, which is to immediately dial 911. Step number 1, call 911. It is important that as soon as you recognize a complete airway obstruction, that you dial 911 immediately. You need first responders en route to the scene as soon as possible. On average, it'll take first responders 7 to 10 minutes to arrive on scene after receiving the 911 call. If you are calling 911 using your mobile device, place the phone on speaker and lay it down somewhere near you. That way, you are able to talk to the dispatcher while still having your hands free to be able to perform choking interventions. Step number 2, perform a combination of 5 back blows and 5 abdominal thrusts. To perform back blows, first, position yourself behind the choking victim. It may be necessary to adjust the height of the rescuer or the rescuee by one or the other dropping down to their knees. Once in the appropriate position height-wise, place one hand on the choking victim's shoulder. With your opposite hand, take the heel of your palm and deliver 5 forceful back blows directly in between the shoulder blades on the choking victim's back. If the back blows were not successful at clearing the obstruction, perform 5 abdominal thrusts. Pull the victim towards you until their back is flush with your chest and your abdomen. Extend your arms out underneath the level of their armpits. Make a fist with your dominant hand and place it just over top of the choking victim's navel. Take your non-dominant hand and place it over top of your fisted hand. From here, roll both hands up until your fists are facing towards you. Turn your head to face either the right or the left to avoid getting struck in the face by the choking victim's head while performing abdominal thrusts. Once in position, pull up and in forcefully 5 times. If the combination of back blows and abdominal thrusts are not successful at clearing the obstruction from the victim's airway, progress to use of the LifeVac airway clearance device. To ensure continued support to the victim, whenever possible, have one person continue to perform back blows and abdominal thrusts while another person retrieves and assembles the LifeVac device. LifeVac can be used on a patient in the laying down, sitting, example in a wheelchair, or standing positions. Depending on the patient's position, it may not always be possible to perform each step of these instructions. For example, for a choking victim who is bedridden or in a wheelchair, it may be difficult to impossible to complete the back blows or abdominal thrusts. I will be demonstrating the device use in both a laying down and seated position. Step number 3 is to first assemble the device by connecting the mask to the suction unit. The masks are clearly labeled adult and pediatric. The pediatric mask can be used for children aged 1 year up to 14.5 years, while the adult mask can be used for adults and children more than 10.5 years of age. Choose the appropriately sized mask for the victim. To insert the mask into the unit, use a twisting motion while applying pressure. Check to ensure that the mask is securely attached to the unit. Once your LifeVac airway clearance device is assembled and ready for use, progress to step number 4. Place one hand on the forehead, tilt the head back, and ensure the chin lifts to open the airway. Ensure the head is supported by a firm, hard surface whenever possible. For a choking victim laying down, this could be the floor. For a seated or standing victim, this may be a wall, the hand of another person assisting, or your body if you were to stand behind the choking victim. Once the choking victim's airway is open, progress to step number 5, which is to place and hold the device. Place the mask over the choking victim's nose and mouth, ensuring the mask is securely sealed to the face with your hand. The mask should be oriented so that the narrow portion of the mask is positioned over the nose and the wider portion of the mask is positioned over the mouth. Once the mask is firmly secured to the choking victim's face, progress to step number 6, which is to push and pull the device. Now, as I described before, the LifeVac device is designed to be used on a choking victim in a laying down, seated, or standing position. For a victim laying down, push down on the handle of the suction unit until it is depressed, creating a tight seal on the victim's face. For a victim laying down, the floor can assist with stabilizing the back of the head as the handle is pushed down. For a victim in the seated or standing position, there are multiple options for achieving a similar type of resistance. If there is another person present, they can stabilize the head of the victim as the handle is pushed inward. A similar type of resistance can be achieved by positioning the victim against a wall or by standing behind the person and bracing the head against one's chest as the handle is depressed. Once the handle is depressed, while keeping the mask secure with the other hand, pull upward with a short, swift tug in an effort to quickly suction the object out of the airway. If the pull feels too easy, it is possible that you do not have an adequate seal on the choking victim's face. If that is the case, reposition the mask onto the choking victim's face and repeat steps number 5 and 6. Once you push and pull the device, progress to step number 7, which is to check for debris. Roll the choking victim onto their side if the choking victim is on the ground, or turn the victim's head to the side if they are sitting or standing. Look in the mouth for any debris and remove it if it is present. Once you have checked the mouth for debris, progress to step number 8, which is to repeat steps number 4 through 7 for a total of 5 times if the victim is still choking. If the victim is still choking, after repeating steps number 4 through 7 5 times, progress to step number 9, which is to repeat 5 back blows and 5 abdominal thrusts. If the choking victim becomes unconscious at any point, immediately get them down to a hard surface and progress to step number 10, which is to start CPR. If you attempt 2 rescue breaths and the chest does not rise, repeat steps number 4 through 7. Step number 11 is to visit www.lifevac.net and fill out the Report LifeVac Usage form. LifeVac will send a free replacement unit. This concludes our training. I commend you for taking proactive steps to ensure the health and safety of you and your community.